Today, I am revealing the exact method of hydration that can help you manage your blood sugar levels and lower your A1C naturally as a senior over 60. Many older adults find that even when they eat the right foods and stay active, their glucose remains stubborn and high throughout the day because of a simple lack of specific water timing and temperature. This uncertainty regarding your daily readings often stems from the hidden thickness of your blood, but I am about to show you how a few simple adjustments to how you drink water can change your metabolic health. I remember a man named George who was 72 years old and struggling with a rising A1C that reached 7.5 despite his best efforts with his diet and daily walks. George was constantly thirsty and dealt with frequent urination, yet his morning blood sugar was always high, leaving him feeling fatigued, dizzy, and worried about his long-term kidney health and the risk of complications. He felt frustrated because his doctor might have been telling him that his medication was the only way to manage these spikes, ignoring the fundamental role of blood viscosity and how cellular hydration impacts insulin sensitivity. Before we dive in, drop a comment telling me your age and where you're watching from, as I want to know my community more and provide the best support for your health journey. 1. The microhydration frequency habit focuses on the way you consume fluids throughout the day rather than the total volume you drink in a single sitting to ensure your blood remains at a healthy consistency. When you drink a large amount of water at once, your body often views this as an excess and signals the kidneys to flush it out quickly, which does not allow the water to effectively dilute the sugar in your bloodstream. For seniors, this can be problematic because the goal is to keep the blood from becoming too thick or syrupy, which makes it much harder for insulin to move glucose into your cells. By taking small, frequent sips of water every 15 to 20 minutes, you provide your body with a steady supply of hydration that maintains a stable blood volume without putting undue stress on your bladder or kidneys. This is easy on the joints and can be done at home comfortably while you go about your normal daily routine without any extra equipment. Maintaining a consistent level of hydration through microsipping helps to prevent the sudden concentration of sugar that happens when your body becomes even slightly dehydrated during the day. As you age, your thirst mechanism becomes less sensitive, meaning your blood sugar could be rising because of dehydration before you even feel the sensation of being thirsty or parched. When the blood volume drops, the concentration of glucose naturally increases, leading to higher readings on your monitor that might not reflect your actual sugar intake from meals. Most older adults can try this safely by keeping a small glass or a reusable bottle nearby and setting a gentle reminder to take a sip even if they do not feel a strong urge to drink. This simple habit ensures that your blood stays fluid enough for your insulin to work at its maximum efficiency throughout the entire day and night. The reason this habit is so effective for A1C control is that it prevents the thick blood syndrome that often affects seniors with type 2 diabetes or prediabetes during the long gaps between meals. When your blood is properly hydrated through frequent sips, the kidneys can more easily filter out excess glucose and pass it through the urine without causing the dehydration that often follows high sugar levels. This creates a positive cycle where your body can manage its internal environment more effectively without the dramatic highs and lows that cause fatigue and long-term damage to the blood vessels. You can do this at home by simply making water your primary companion throughout your morning and afternoon activities to ensure your glucose levels stay within a healthy and predictable range. Consistent microhydration is a foundational step for maintaining stable blood sugar and preventing the concentration of glucose in the senior body. 2. Thermal hydration, or the practice of drinking warm or room temperature water, is another highly effective strategy for seniors who want to support their metabolic health and improve their digestion. Many people are accustomed to drinking ice-cold water, but for an older body, this cold temperature can cause the blood vessels in the digestive tract to constrict, which may slow down the processing of nutrients and the management of glucose. Warm water helps to keep the internal systems relaxed and improves blood flow to the stomach and intestines, which is vital for the steady absorption of sugar after you have finished a meal. This is easy on the joints and supports overall internal comfort, especially for those who struggle with digestive issues or slow metabolism as they get older. Most older adults can do this comfortably by simply avoiding the refrigerator and choosing to drink water that is closer to their own body temperature. Drinking warm water has been shown to improve gastric emptying, which is the rate at which food leaves the stomach and enters the small intestine, where sugar absorption primarily occurs. When you drink warm water, it helps to break down food more efficiently, allowing for a more gradual release of glucose into the bloodstream rather than a sharp and sudden spike that can be difficult for your body to handle. This gentle approach to hydration is much kinder to the senior system and can help reduce the feeling of bloating or heaviness that often accompanies diabetes-friendly meals that are high in fiber. You can do this at home by keeping a thermos of warm water or simply letting your tap water sit until it reaches room temperature before you decide to take a drink. A recent study suggested that consuming warm liquids can slightly increase the body's internal temperature, which may help to stimulate the metabolism and improve the way your cells respond to insulin throughout the day. While this effect is subtle, every small advantage counts when you are working to lower your A1C and keep your fasting blood sugar levels within a healthy and safe range for your age group. By choosing warm water over cold, you are providing your body with a tool that supports the natural rhythm of your digestion and prevents the systemic shock that cold fluids can sometimes cause to sensitive internal organs. This fits into any routine and is a very simple change that requires no special ingredients or expensive supplements to implement starting today. Choosing the right water temperature is a gentle way to ensure that your digestive system and blood sugar management work together in harmony. 3. Premeal water loading is a specific technique where you drink exactly 1 or 2 cups of water approximately 20 minutes before you sit down to eat your main meals of the day. This habit is designed to prime your digestive system and create a sense of fullness that prevents overeating, but its impact on blood sugar goes much deeper than just weight management for seniors. When you drink water before a meal, it helps to expand the stomach lining, which sends signals to the brain that you are beginning to feel satisfied before you have even taken your first bite of food. This allows you to make better choices about your portions and reduces the likelihood of consuming excess carbohydrates that would lead to a significant glucose spike after the meal is finished. Most older adults can try this safely and will find that it significantly improves their post-meal energy levels and reduces the sugar crash feeling. The water you drink 20 minutes before a meal also helps to dilute the enzymes and stomach acids just enough to slow down the initial breakdown of simple sugars, leading to a more controlled rise in blood glucose. This is particularly important for seniors whose bodies may not produce insulin as quickly as they used to, as it gives the pancreas more time to respond to the incoming nutrients from the food. By creating this water buffer, you are essentially slowing down the train of glucose as it enters your system, making it much easier for your body to maintain a flat and steady line on your continuous glucose monitor. This is easy on the joints and requires nothing more than a glass of plain water and a little bit of patience before you begin your breakfast, lunch, or dinner. Scientific observations have shown that individuals who practice premeal hydration often have lower overall glucose levels throughout the day compared to those who drink water only during or after their meals. This simple timing strategy works by utilizing the body's own satiety hormones to regulate the speed of digestion and the subsequent release of sugar into the pipes of the circulatory system. You can do this at home with any source of clean water, and it is a habit that fits perfectly into a senior lifestyle that prioritizes health and longevity without needing complex medical interventions. This is a very effective way to ensure that your meals provide you with steady energy rather than causing the dangerous spikes that can lead to long-term health complications. Preloading with water is a powerful and natural method to dampen the impact of carbohydrates on your blood sugar levels. 4. Magnesium and mineral-rich hydration involves selecting water sources that contain natural electrolytes or adding trace minerals to your water to improve the way your cells interact with insulin. Magnesium is a vital mineral for seniors because it acts like a key that helps to unlock the cells so that glucose can enter and be used for energy rather than staying in the blood and raising your A1C. Many seniors are actually deficient in magnesium, and since the body loses minerals through the urine, especially if blood sugar is high, it is essential to replenish these nutrients through the water you drink every day. This is a safe and easy habit that most older adults can incorporate by looking for mineral water or using simple, doctor-approved mineral drops to enhance their daily hydration. When your water is rich in minerals like magnesium, potassium, and calcium, it becomes more bioavailable, meaning your body can use it more effectively to maintain the electrical balance required for healthy cell function. This balance is critical for insulin sensitivity, as the receptors on your cells need these minerals to respond correctly to the signals sent by your pancreas to lower your blood sugar levels. Without adequate minerals, the water you drink might simply pass through your system without actually hydrating your cells or helping to clear the sugar from your blood. You can do this at home by checking the labels on your bottled water for mineral content or by choosing spring water over highly processed distilled water that has had its natural nutrients removed. Recent research has highlighted that seniors who maintain optimal magnesium levels through their diet and hydration have a much lower risk of developing severe insulin resistance and are better able to manage their type 2 diabetes symptoms. By focusing on the quality of your water rather than just the quantity, you're giving your body the specific tools it needs to keep your metabolism running smoothly as you age. This is easy on the joints and supports a healthy heart and nervous system in addition to its benefits for blood sugar and A1C control. Ensuring your water contains essential minerals is a key strategy for improving insulin sensitivity and maintaining a healthy internal environment for your glucose management. 5. The soluble fiber and water synergy is a habit where you coordinate your water intake specifically with the consumption of fiber-rich foods like beans, lentils, oats, and certain vegetables. Fiber is excellent for blood sugar, but it requires a significant amount of water to work correctly in the senior digestive tract to prevent constipation and ensure a slow release of glucose. When you drink water alongside these foods, the soluble fiber turns into a thick, gel-like substance in your stomach that acts as a physical barrier to the rapid absorption of sugar into your bloodstream. This synergy is one of the most effective natural ways to keep your glucose levels from rising too quickly after a meal, making it an essential practice for anyone over 60 who is monitoring their A1C. Most older adults can try this safely and will find that it makes their fiber-rich meals much more comfortable and effective for their health goals. If you eat fiber without drinking enough water, the fiber can become stagnant in your system, which may lead to digestive discomfort and may actually hinder your body's ability to manage sugar efficiently. However, when the fiber is well hydrated, it moves smoothly through the intestines, picking up excess sugar and cholesterol along the way and preventing them from entering the blood in large quantities. This is particularly helpful for managing the second meal effect, where a fiber-rich breakfast helps to keep your blood sugar stable not just for that meal, but for the next meal as well. You can do this at home by making sure you have a full glass of water with every high-fiber snack or meal you consume during the day to maximize the glucose-lowering benefits of your diet. This is easy on the joints and provides a natural way to support your gut health while simultaneously protecting your blood sugar levels from unnecessary fluctuations. This relationship between hydration and fiber is a cornerstone of a successful diabetes-friendly lifestyle because it uses the physical properties of food and water to regulate your internal chemistry. By ensuring that your digestive system has the fluids it needs to process fiber, you are creating a slow-motion delivery system for glucose that prevents the roller coaster effect that many seniors experience with their sugar readings. This habit is simple to follow and requires no special tools, just a conscious effort to drink water whenever you are eating foods that are known to be high in complex carbohydrates or fiber. You can do this at home every day to ensure that your body is getting the most out of the healthy foods you choose to eat. Combining water with soluble fiber is a reliable way to create a natural buffer against blood sugar spikes and improve your overall metabolic health. 6. Managing the dawn phenomenon with morning hydration is a crucial strategy for seniors who often wake up with high blood sugar levels even if they haven't eaten anything for 8 to 10 hours. The dawn phenomenon occurs because the body releases hormones like cortisol and growth hormone in the early morning hours to prepare you for the day, which can cause the liver to dump extra glucose into the bloodstream. By drinking 12 to 16 ounces of water immediately upon waking, you can help to dilute this early morning sugar surge and signal to your kidneys to begin processing the excess glucose right away. This is a very simple habit that most older adults can do comfortably before they even have their first cup of tea or coffee, and it can make a significant difference in your fasting blood sugar readings over time. When you wake up, Your body is naturally in a state of mild dehydration after several hours of sleep, which makes your blood more concentrated and your sugar levels appear higher than they might otherwise be. Providing your system with fresh hydration first thing in the morning helps to restart your metabolism and supports the liver in its job of regulating glucose without the need for immediate food intake. This morning water ritual can also help to suppress the hunger hormones that might lead you to eat a large breakfast that would further increase your sugar levels after the dawn phenomenon has already raised them. You can do this at home by keeping a glass of water on your nightstand so it is the first thing you reach for when you open your eyes in the morning. This is easy on the joints and helps to clear the brain fog that many seniors feel when their blood sugar is slightly elevated in the early hours of the day. Consistency with morning hydration is one of the most effective ways to lower your average A1C because it addresses the high fasting levels that often pull the entire average upward. By flushing your system early and frequently, you're giving your body a clean slate for the rest of the day and making it easier for your medications or lifestyle choices to keep your sugar in the target range. Many older adults find that this one simple change reduces the frustration of seeing high numbers on their monitor first thing in the morning and provides them with a sense of control over their health journey. This fits into any routine and is a safe practice for almost everyone, providing a gentle and natural way to manage the body's early morning hormonal shifts. Immediate morning hydration is a vital tool for seniors to combat the dawn phenomenon and start their day with balanced blood sugar. 7. Herbal-infused water with cinnamon or ginger is a pleasant and effective way for seniors to stay hydrated while also providing their body with natural compounds that have been shown to improve insulin sensitivity. While plain water is excellent, adding a stick of cinnamon or a few slices of fresh ginger to a pitcher of water allows the water to absorb active ingredients that help the cells process sugar more efficiently. Cinnamon, in particular, contains antioxidants that mimic the action of insulin and can help to lower blood sugar levels by improving the transport of glucose into the cells of the muscles and liver. This is a very easy habit to start at home and is a great alternative for those who find plain water unappealing or difficult to drink in large quantities throughout the day. Ginger is another powerful addition to your hydration routine because it has anti-inflammatory properties that can help reduce the chronic inflammation often associated with type 2 diabetes and high A1C levels. When the body is less inflamed, the insulin receptors on the surface of your cells can function more effectively, allowing for better blood sugar control with less effort from the pancreas. Drinking ginger-infused water is a gentle way to support your digestion and your metabolic health at the same time, and it is very easy on the joints and the stomach for most seniors. You can do this at home by simply adding these natural ingredients to a jar of water and letting it sit in the kitchen or the refrigerator for a few hours to infuse the beneficial properties into the liquid. Recent studies have shown that the regular consumption of cinnamon and ginger can lead to measurable improvements in fasting blood glucose and A1C levels in older adults over a period of several weeks. By incorporating these spices into your daily water, you are turning a simple hydration task into a functional health treatment that supports your long-term wellness goals. This approach is factual and simple, avoiding the sugar and artificial sweeteners found in many store-bought, enhanced waters that would otherwise cause your glucose to spike. Most older adults can try this safely and will enjoy the subtle flavor while knowing they are taking a proactive step toward better blood sugar management. Herbal infusions are a delicious and senior-friendly way to enhance the blood sugar-lowering power of every glass of water you drink. 8. The nighttime hydration buffer is a technique that involves balancing your fluid intake in the evening to ensure you stay hydrated through the night without causing excessive disruptions to your sleep. For seniors, staying hydrated during the night is important because dehydration can cause blood sugar to rise while you sleep, leading to higher fasting numbers in the morning and a feeling of stiffness in the joints. However, drinking too much water right before bed can lead to multiple trips to the bathroom, which can ruin your sleep quality and actually stress the body, leading to higher cortisol and higher glucose. The best approach is to have your last significant glass of water about 2 hours before you plan to go to sleep, followed by only small sips if you feel thirsty later in the evening. This 2-hour window allows your body to process the fluid and empty the bladder before you get into bed, ensuring that you can rest deeply while still having enough water in your system to keep your blood at a healthy consistency. Sleep is a critical time for the body to repair tissues and for the liver to regulate glucose, and being properly hydrated supports these nocturnal processes without the interruption of nocturia. If you find that you wake up with very high blood sugar, it may be a sign that you are becoming too dehydrated during the night, and adjusting your evening hydration buffer could be a simple and effective fix. You can do this at home by tracking your evening water intake and noticing how it correlates with your morning readings and your sleep quality. Maintaining a steady level of hydration through the night helps to prevent the blood from becoming sluggish, which is a common issue for seniors who may have slower circulation. Proper nighttime hydration ensures that what little insulin your body is producing or receiving can circulate freely to your cells while you are in a fasted state. This is easy on the joints and helps to prevent the muscle cramps that many older adults experience when they are dehydrated during the late night or early morning hours. By being mindful of your hydration timing in the evening, you are supporting your body's ability to maintain stable glucose levels even when you are not awake to monitor them. The nighttime hydration buffer is a practical and effective way for seniors to protect their blood sugar health while ensuring a restful and uninterrupted night's sleep. 9. Using water as a substitute for liquid carbohydrates is perhaps the most direct way that hydration can help a senior lower their A1C and manage their type 2 diabetes. Many beverages that are marketed as healthy or natural, such as fruit juices, sweetened teas, and even some meal replacement shakes, contain high amounts of liquid sugar that enter the bloodstream almost instantly. When you replace these drinks with plain, mineral-rich, or herbal-infused water, you remove a major source of glucose spikes from your daily routine, allowing your body to stabilize its insulin production. This is an easy change that most older adults can make at home, and the results are often seen very quickly in their daily blood sugar monitor readings. Liquid sugar is particularly dangerous for seniors because it does not require much digestion and bypasses the fiber buffer that would normally slow down the absorption of sugar from whole fruits or grains. By choosing water every time you are thirsty, you are ensuring that your body only has to deal with the glucose from your solid meals, which is much easier for your system to process and regulate. This habit is factual and simple, requiring no special skills other than the discipline to choose the most natural hydration source available to humans. You can do this at home by gradually phasing out sugary drinks and replacing them with a refreshing glass of water flavored with a squeeze of fresh lemon or lime if you need a bit of variety. Replacing sugary beverages with water has been shown in countless studies to be one of the most effective ways to lower A1C levels and reduce the risk of diabetes complications in the senior population. Not only does it lower your caloric intake, but it also reduces the chronic inflammation that sugar causes in the blood vessels and joints of older adults. This is a very senior-friendly habit that fits into any lifestyle and provides immediate benefits for your energy levels, mental clarity, and overall glucose balance. You can do this at home starting today, and your body will thank you for the clean, pure hydration that supports every biological function without the burden of excess sugar. Making water your primary beverage is a fundamental and powerful step toward long-term blood sugar stability and health for seniors. 10. Understanding the connection between dehydration and false high readings is essential for seniors who may be worried about their blood sugar monitor results. Sometimes, a high reading on your glucose meter is not caused by the food you ate, but rather by the fact that your blood volume is low due to a lack of water, which makes the sugar in your blood appear more concentrated than it actually is. This can lead to unnecessary stress or even incorrect adjustments to your medication if you are not aware of how hydration affects the accuracy of your tests. By ensuring you are properly hydrated before you take your blood sugar measurements, you can get a much clearer and more accurate picture of how your body is truly managing its glucose levels throughout the day. For older adults, the skin on the fingertips can also become drier and less hydrated, which can sometimes interfere with the quality of the blood sample taken for a glucose test. Drinking a glass of water and ensuring your hands are warm and well-perfumed with blood flow can help you get a better sample and a more reliable reading. This is a simple fact that most seniors can use to their advantage to avoid the anxiety that comes with an unexpectedly high number on their screen. You can do this at home by simply making it a rule to drink a small glass of water 30 minutes before you plan to check your blood sugar to ensure your system is well equilibrated. If you're finding this information helpful, click that red subscribe button. For you it's free, but for me it means a lot, as it helps me deliver reliable blood sugar and diabetes health tips for seniors over 60. You can also share this video with someone who could benefit from it. Proper hydration is the silent partner in your diabetes management plan, and knowing how to use it correctly can save you from a lot of uncertainty and worry. Always remember that your body needs water to perform the basic task of moving sugar out of your blood and into your cells where it belongs. By staying consistent with these hydration habits, you are providing a solid foundation for your A1C goals and your overall well-being as a senior.